at the Cloud9 Hospital. I have my own clinic at Dr. Chetna's clinic in the Palam Vihar. Today we are going to talk on what are the signs of unhealthy pregnancy. Unhealthy pregnancy is a very common phenomenon. Up to 20% of all pregnancies are lost these days. That means one in five. Now, majority of the pregnancies are lost before 10 weeks of pregnancy. If anybody has bleeding in early pregnancy, this could be a sign of abnormality. However, not all who bleed during pregnancy have any problem. So it is important, if you have spotting or bleeding at any time, to verify that there is heartbeat if it is early pregnancy, that the pregnancy is inside the uterus, that the baby's heartbeat is okay, and that the placenta is not shifting or separating from the uterine wall. So these could be the problems once you have bleeding in pregnancy. Now there could be cramps. So little bit of cramps on the sides are very common, which are because of the round ligament stretch. However, if you have uterine cramps coming in, just like periods, are gradually increasing and greater in intensity, especially before 37 weeks, this could be a preterm labor, and report to the hospital or your treating doctor immediately as soon as possible. The third feature could be a low HCG level on your double marker. On double marker, sometimes low HCG levels are associated with miscarriage, but the range is so vast that you should not interpret it yourself and leave it to your treating doctor, who will decide whether your levels are okay or no. But very low levels can lead to future growth restriction or other abnormalities in the child. Then there could be less fundal height. That means whenever you lie down after the 16 weeks or 14 weeks of pregnancy, the doctor measures the fundal height. This is measured from the symphysis pubis or the bikini line to the top of the uterus or the womb, and this is known as symphysis fundal height, and this is measured in terms of weeks. If the doctor feels that the growth is less, the size is less, it could be because the growth is less or the water is less or the baby is in an abnormal position. Sometimes the height could be more, which happens in a twin pregnancy or when the water is more. So these are the conditions when the height could be more. In triplet pregnancy, certainly the fundal height is beyond. There are certain things like fibroids also can give rise to larger than normal uteruses. Some women can have bigger uteruses than others. So this needs to be verified by doing an ultrasound. Heartbeat. So heartbeat is typically seen by 6 weeks of pregnancy by ultrasound. Now, if heartbeat is not seen by 7 weeks of pregnancy by transvaginal ultrasound or 8 weeks by abdominal ultrasound, one has to worry. Uh, by Doppler, the heartbeat is typically seen between 14 and 16 weeks of pregnancy and then continue to be heard till term. Anytime, if the heartbeat is not heard, then it needs to be verified by ultrasound. We talked of intrauterine growth restriction. That means the baby is not growing well. Majority of the babies grow equally till 20 weeks of pregnancy. The genetic differences, they start showing beyond 20 weeks, wherein an American mother would deliver a 4 kg baby easily, wherein a people from shorter stature like a Bangladeshi lady would deliver something like 2.5 or 2.7. Indian women tend to deliver between 2.8 and 3.2 depending on their race, from which race they're coming in. Northern women, they deliver, or Punjabi women deliver bigger babies compared to people from Orissa. So there's a genetic difference between the size of the baby and also depending on the nutritional status. Now, pain in abdomen before 37 weeks of pregnancy, which comes like menstrual cramps, which comes and goes, and if the contraction is happening more than 2 or 3 times in 1 hour, this could be labor, it could be preterm labor, and see your doctor immediately. Leakage of fluid from the vagina, which is pure water, is another alarming sign before term, and this also needs to be seen. At term also, you must report there's a possibility of water breakage. So there could be significant confusion between the vaginal discharge, which could be normal, or a breakage of water. A typical vaginal discharge on the underwear will make a straight streak, which could be white if it is a fungal infection or yellowish if it is a bacterial infection. The water which comes out from the baby is typically giving rise to a round shaped stain on the underwear. It looks more like urine It is without any smell or color. Very rarely it could be greenish in color if the baby has passed stool. Now, fever during pregnancy. So anytime, if you have persistent fever more than 100, we have to look for cause. The causes could be many. Most common tests done are complete blood count and urine routine. There could be other tests which are required are typhoid, dengue, and malaria, which are endemic in our area. That means very common. However, we are not immune to tuberculosis also. In current times, COVID also becomes a real possibility. So if the woman is also having breathlessness, exclusion of COVID is a must. Sometimes some kinds of viral infections like torch infections can also lead to low-grade persistent fever. Now these are most dangerous because they can infect the baby and can lead to certain anomalies in the baby. And if any woman is having sudden weight gain, persistent headache, swelling, or fits, this is something very serious. Measure your BP immediately. This could be very serious. Now, reduction in the breast size, that's the breast is growing well in the pregnancy, or it doesn't grow sometimes. But if once it has grown suddenly, it shrinks and you don't feel any movements, it could be a sign of alarm and consult your doctor. Now, if you start appreciating your fetal movements anywhere between 18 and 22 weeks, those who have experience can experience it early at 18, and those who are thin, they can also experience it at 18. Most can experience at 22, when some women who are obese, who have anterior placenta, can have difficulty in perceiving the fetal movements. But majority of the women can perceive some kind of fetal movement beyond 22 weeks. The kicks are real beyond 26. So there has to be continuous movement beyond 26. If any time a day the gap is more than 3 hours, you must report to a doctor. So a count could be done. So one kick per hour, and the baby at bed sleeps not more than 3 hours. If 3 hours you don't feel the movement, you must go to the hospital to verify that the baby is fine. Sudden rise in blood sugar levels can happen in pregnancy. This is more common in patients with PCO who have a family history, who have a personal history of sudden baby gain, who deliver large babies in the past, and who are showing bigger babies on ultrasound or clinical examination. So these are the women who should control their weight anytime. A very high blood sugar is harmful to the baby because when the baby comes out, when the maternal blood sugars are high, the baby sugar dips at birth and can need hospitalization, drips, and sometimes it can lead to seizures in the baby. Now, placenta position, always check your placenta on ultrasound. For majority of the women till 20 weeks, placental location is of not much value, but at 20 weeks scan, if the placenta is still covering the os, if it is reaching, it is likely to migrate. But if it is covering the os, we need to specifically monitor the lady for a placenta previa, that means a low-lying placenta. There should not be any excess cramps all over the body in pregnancy. Leg cramps are very common, which can be alleviated by leg massage, TED stockings, or there could be some medications which can be given. There are some massage oils also available which can be used. But a persistent cramps and stuff like that needs to be investigated for thyroid and parathyroid especially. We talked about breathing during pregnancy, extreme backache. So backache is very common in pregnancy. Majority of the women will develop some kind of backache, and this is because of the lumbar lordosis, wherein the center of the gravity moves back and your tummy is falling forwards, and there's a lot of curvature on the lumbar spine. So in this case, if you do exercise regularly from early pregnancy, your muscles will be strong and will be able to take a lot of load of the full-term pregnant uterus, and you should not suffer backache. But once you have it, you must consult an orthopedist and a physiotherapist to know how best to alleviate it through exercises and various techniques. So vaginal discharge, if it is if water leaks before 28 weeks of pregnancy, then it is difficult to salvage the pregnancy. However, we try to put the patient on bed rest with antibiotics and different relaxants and try to see if we can pass on a few weeks. A lot of women do give rise to give birth to healthy babies beyond 26 weeks. However, there are significant difficulties for children born before 26 weeks. So it is important to monitor carefully for pain, for leaking, for bleeding, or for less sleeping moments. If there's a sudden discontinuation of morning sickness, so in early pregnancy till the time you cannot feel the fetal movements, if you're having significant fetal morning sickness, and one morning when you get up, you don't find yourself sick, then it is important to verify that the baby is doing fine. So these are the common problems which can happen to any pregnant woman during pregnancy, and one needs to look after. Along with that, you need to monitor your blood sugar, blood pressure, hemoglobin very particularly, and you must monitor your urine for protein. And hemoglobin has to be above 11, sugar fasting below 94, PP sugar 2 hours from onset of meal should be below 118. The thyroid also needs to be monitored. Anybody who's not taking medicine because of the poor control should take. If the dose needs to be rectified by the doctor, needs to be done. Do not hesitate in taking adequate treatment. Do not believe that this medicine is going to last forever, because after delivery, when you lose weight, majority of the women are able to get rid of their BP medicine, sugar medicine, or thyroid medicine. So these are the common problems which we come across. Then there could be other complications of pregnancy which do not arise out of pregnancy, but they are pre-existing conditions which are high risk pregnancy, like diabetes, hypertension, epilepsy, heart disease, kidney disease, liver disease, brain disease, and so on, which is a different topic and which we are not going to take up today. But if you have any specific questions, do write to us at janchetna@gmail.com. It's again janchetna@gmail.com, and I would be responding to you individually. If you have any questions at this point, please write to us. Otherwise, we conclude the session. So we have a question here. What is the what are the do's and don'ts of unhealthy pregnancy? Well, you can't do much about it, but certainly to keep yourself pregnancy healthy, you must exercise regularly, you must eat healthy, you must get up on time and sleep on time, you must do some mental activity. Puzzling is extremely important. Puzzle your mind so that your baby comes. So if you've heard the story of Ivanyu, her mother did a lot of studies and stories and during pregnancy, and that's how he came out to be so clever. So it works. You must do some kind of puzzles, mathematical or otherwise mental aptitude techniques, because this will enlighten your baby's brain and mind, and it will activate it, and it helps in developing a better brain of the fetus. What you can do is so exercise regularly, eat healthy, think positive, take your medications on time, do your investigations on time, believe in your doctor, whatever tests are prescribed, please do it. And towards the end, the most important thing is it's God's decision whether any complication will arise or no. You can only minimize it, but certainly you can't prevent 100% of complications. What are the symptoms of unhealthy pregnancy? So, pain during pregnancy, bleeding during pregnancy, water leakage during pregnancy, headache, double vision, abnormal blood sugars, abnormal blood pressure, excessive weight gain, no fetal movements, uh, bleeding. So these are the abnormal pregnancies wherein abnormal fetuses and seen by ultrasound. These are the signs and symptoms of. And if you're vomiting also too much, you must rule out a molar pregnancy, wherein a grape-like growth grows inside the uterus. Multiple pregnancy also leads to a lot of morning sickness. So it is important to exclude any complication by seeing your doctor. Thank you.